Hey, I'm Jason Pozner from Boca Raton, Florida, and I'm here with Kristi Hustak from Houston, Texas. World famous plastic surgeon Kristi Hustak. And we're gonna talk about something really fun today, right? We're gonna talk about 90 Day Fiancé. We saw this story about Larissa Lima from 90 Day Fiancé. She was married to one guy, now she's with another guy. She was on the show, then she was thrown off the show. And she's got some plastic surgery and got some attention to herself. So I'll let you go first and then I'll chime in.
Well, I think the one interesting thing about her that everybody, like the hot trendy thing right now, people are asking for is this whole fox eye lift, right? So you lift the corner of it, that really exaggerated tail of your brow elevation. They're calling it the Hadid lift as well, because there's a lot of famous, the Kendall Jenner, a lot of them are getting that little thread lift, exaggerated tail up. And so I think she had that too. So that was kind of what that article was about, was this new fox eyelid lift. I am a big fan of trends that are reversible or temporary. So fine, if you want to look like a cat for a month or so, I'm all for that. I always, get really against things when it's
have you done those?
Permanent.
Have you done any of those thread lifts in the brow?
Not for the fox. I've done some thread lifts. I think it's a lot of hoopla. I mean, it may stimulate a little bit of collagen, but I think most of my patients are coming because they don't want temporary fixes. But I've tried just normal brow lifts with the threads. I don't think they're very profound. But exaggerated, to be a cat for some Halloween party, why not?
Yeah, I'm with you. I mean, I usually everyone wants their brows up a little bit, and I just usually throw a little bit of Botox in there to get them up. But I think the main thing for me is, like, I've been in this game for a while, and I've had some of the patients that I've been injecting for a while. And the key is, don't overdo their foreheads as they get older, because then they're yelling at you that their brows fell down.
That's a really great point. We get a lot of people coming in with really heavy things, and they don't understand why, and it's because their forehead's overdone.
Yeah.
You do not need that much, like you said, particularly as you age. So.
You can always come back and do more. But,
Absolutely.
she's also had some other assets fixed. You want to comment on that?
Tell me more, yeah.
Right. So, I mean, it looks like she's had her boobs done, and it was kind of obvious in the show because she was talking about getting her boobs done, and she was showing them off using a very low-cut outfit. I mean, they're pretty big. I mean, they look, whoever did them, I think did a nice job on them. They're pretty big. They're Florida and Texas size, I think.
Absolutely.
They're not New York size.
Fine. She's young. I mean, all those things are reversible. I think I'm seeing a trend actually not of the big breasts. I'm seeing much more the opposite now. I'm seeing a lot of downsizing, more athletic breast requests. I don't know if you're seeing those too, but
the older ladies, like I see a lot of menopause got bigger, so I do a lot of R&R downsize, remove and replace, downsize, mastopexy, Galaflex.
Yeah, nice. I'm loving the Galaflex. How about like if you were to do Larissa's big old cha-cha she got, would you reinforce that lower fold with Galaflex primarily, or
depends what they look like. Depends what her tissues look like. On a lot of the secondaries that I'm doing lifts on, I'm putting the I like the form, the shape, but they just changed the name on it. I like the one with the rim around it. I do a lot of that. But most of the patients are having a lift, and by definition, to me, that their skin's kind of crappy to start with. So I'm using it to reinforce the tissue. I've done a couple of primaries who have crappy skin, but in general, I'm using it more for the tough revision cases, or all the lift cases are getting it.
Excellent. Yeah,
I just did a virtual consult on a girl with a little bit of symastia. So I told her I would use the mesh to push them up, keep them apart a little bit. She just really needs them open laterally. But we both love this product, and the question she asked me is like, why do some of the other doctors not use this product? And I think they like to badmouth stuff that they don't have experience with.
Right, and there's a bit of a learning curve, you know what I mean? And so you've got to figure out, how you like to use it in your hands. And like you said, some people are just like, I don't use mesh, and that gets kind of a bad name. But we know that's a different kind of product. But anyways,
and like to me, I think you and I are the same thing. If she wants them and she can carry them off, good for her. We can always downsize her later if she needs it. But I like, the women always ask you, what do you think? I go, they're your boobs, you got to carry them, not me.
I say the exact same thing. I was like, oh doc, what should I pick? And I was like, we try on all the sizers, and I said, I'm not the one carrying them around, so don't can I get those safely in? Yes.
Yeah, exactly. I mean, it's like, but that's it. I totally agree with you. So, like, I think with this girl, look, she's looking for some attention. One of the other things is there was a new porn site that she was on. So she was on this new porn site. So they threw her off of 90 Day Fiancé. Okay.
Oh, against their contract, right? You can't
Yeah,
have
so, well, I get that. 90 Day Fiancé is a family kind of thing. You can't be on porn sites.
Yeah, it is what it is. Yeah.
It is what it is. Larissa, good for you. If you like your new boobs and your cat eyes, you didn't do anything to make you look really horrible. To me, I think that the one thing is, on a serious note, my view is that plastic surgery is getting a little bit more natural looking, especially on the facial stuff. People aren't looking for that pull tight look. They're looking for they don't want to stand out. They don't want to look like Kenny Rogers. So I think a lot of our consults have to be, look, especially on the facial side of things, you're going to look younger and better. You're not going to look different. On the body stuff, so once in a while I get people asking for too much fat in the butts, and that's not my aesthetic.
Right, and I think that's you hit the nail on the head right there. You're going to gravitate for a different surgeon that has a different aesthetic, and so the best thing that I can do sometimes if I don't agree is just say no. Say this is not something I'm willing to do because I think it may impact you, or it's just not my aesthetic and it's not safe or whatever it is, and just say no. I'm sure she'll find somebody else that will give her that aesthetic. It just doesn't have to be me if I don't agree. So.
Alrighty, guys.
All right, Jason, have a good one.
Jason and Kristi from Plastic Surgery Channel. Go to our YouTube channel and subscribe, and then you'll get a lot of these new videos coming every couple of weeks.